A 97% kill rate. Let that number sink in for a second. That's deadlier than Ebola, deadlier than rabies once symptoms appear, deadlier than almost any pathogen on the entire planet. And the creature responsible for this carnage? It's not some apex predator with razor-sharp teeth. It's not venomous. It's not even visible to the naked eye. It's a single-celled organism that lives in warm freshwater, and right now, it's probably in a lake near you. This is Naegleria fowleri, the brain-eating amoeba, and nothing about it is normal. Here's why. Now, before we dive into the nightmare fuel, let me clarify something important. The brain-eating amoeba doesn't actually want to eat your brain. You're not its natural prey. This organism evolved millions of years ago to hunt bacteria in warm sediment, living a perfectly harmless existence in ponds, lakes, and hot springs. But about 50 years ago, scientists discovered something terrifying. If this amoeba accidentally wanders into your nasal passages, it can't find its way back out. So it does what evolution programmed it to do. It hunts. Except instead of bacteria, it's consuming your brain tissue, and once symptoms start, you have about 5 days to live, maybe less. The statistics are genuinely horrifying. Since the 1960s, roughly 450 cases have been documented worldwide, and out of those 450 infections, only about 16 people have survived. 16. That's a survival rate of less than 3%. And here's the kicker. By the time doctors figure out it's not bacterial meningitis or a bad flu, it's usually too late. Standard treatments don't work. Antibiotics target bacteria. Naegleria fowleri is a eukaryotic organism, more similar to your own cells than to bacterial cells. Most drugs that kill it also damage human tissue. So you're left with a microscopic predator systematically destroying your frontal lobe, while modern medicine scrambles to find anything that might work. And more often than not, it doesn't. But what exactly is Naegleria fowleri? Well, it belongs to a group called free-living amoebas. Unlike parasitic amoebas that evolved to live inside hosts, free-living amoebas are environmental organisms. They live independently in soil and water, feeding on bacteria, hunting through sediment, minding their own business. Naegleria fowleri thrives in warm freshwater, specifically temperatures between 77 and 115 degrees Fahrenheit. It's been found in lakes, rivers, hot springs, poorly maintained swimming pools, water heaters, and even industrial cooling systems. Anywhere warm, stagnant freshwater exists, Naegleria fowleri can survive. It's been detected extensively in the southern United States, Texas, Florida, Arizona, but also in northern states during summer months when water temperatures rise. It exists in Europe, Australia, Asia, basically anywhere with appropriate conditions. And here's the thing. You've probably swum in water that contained it. Most people have. The difference is how the water enters your body. If you swallow it, you're fine. Stomach acid kills it instantly. If it touches your skin, nothing happens. It can't penetrate intact skin. The only way Naegleria fowleri becomes deadly is if contaminated water goes up your nose with enough force to push it deep into your nasal passages. That's the gateway. And once inside your nose, it doesn't recognize that it's in the wrong environment. It just starts migrating toward what it perceives as a food source. And that food source is your brain. Now, Naegleria fowleri has 3 distinct life stages, and understanding them is key to grasping how infections happen. The first stage is the cyst. When conditions become unfavorable, cold temperatures, lack of food, chemical stress, Naegleria transforms into a dormant cyst. The cell develops a tough, double-layered wall, shuts down all metabolic activity, and waits. In this form, it's almost indestructible. Cysts survive freezing, drying, and even some chemical treatments. They can remain dormant for years, sitting in dried sediment or cold water, completely inactive. Then, when temperatures rise and moisture returns, the cyst breaks open. The amoeba emerges and enters its second stage, the trophozoite. This is the active feeding form. The trophozoite is what we typically think of when we picture an amoeba, a blob-like cell that moves by extending pseudopodia. temporary arm-like projections that pull the cell forward. It hunts bacteria by engulfing them, a process called phagocytosis. The amoeba surrounds its prey, pulls it inside, and digests it in specialized compartments called food vacuoles. This is how Naegleria fowleri normally lives, crawling through warm sediment, hunting bacteria, reproducing by simple cell division. Completely harmless to humans as long as it stays in the environment. But there's a third stage, and this one is critical to understanding how infections happen: the flagellate form. When environmental conditions shift suddenly, like when water flow increases or oxygen levels change, Naegleria fowleri can transform into a pear-shaped cell with two whip-like flagella. These flagella beat rapidly, propelling the organism through water much faster than the crawling trophozoite form. This transformation happens within hours. The amoeba reshapes its entire structure, grows flagella, and becomes a swimmer. And here's why this matters. Flagellate forms are more likely to be suspended in water rather than sitting in sediment. They're more likely to be inhaled when someone dives or jumps into warm water, forcing water up their nose. That's the moment of infection, and once it happens, the countdown begins. When contaminated water enters your nasal passages, Naegleria fowleri in its trophozoite or flagellate form gets pushed deep into your nasal cavity. The nasal cavity is lined with olfactory epithelium, specialized tissue responsible for smell. This tissue is unique because it's one of the few places in the human body where the nervous system is directly exposed to the external environment. Olfactory neurons extend through a structure called the cribriform plate, a thin, sieve-like bone at the base of the skull that separates the nasal cavity from the brain, and Naegleria fowleri can detect those neurons. It's not clear exactly how, but research suggests the amoeba follows chemical gradients. Neurons release specific compounds, and the amoeba, programmed by millions of years of evolution to follow chemical signals toward bacteria, follows these signals instead. It migrates toward the olfactory nerves, attaches to the epithelium, and begins moving along the nerve pathways. Then it does something extraordinary and horrifying. It crosses the cribriform plate. This bone barrier is supposed to protect the brain, but the amoeba squeezes through the tiny openings where olfactory nerves pass through. Once across, it enters the subarachnoid space, the area between the skull and the brain filled with cerebrospinal fluid. And now, it's inside your central nervous system. With direct access to brain tissue, and what happens next is a systematic destruction of the frontal lobe. Naegleria fowleri doesn't infect the entire brain uniformly. It concentrates in the olfactory bulbs and frontal cortex, the regions closest to its entry point. The amoeba begins feeding, but instead of bacteria, it's consuming neurons, glial cells, and blood vessels. It uses the same phagocytosis process it evolved for hunting bacteria, extending pseudopodia, engulfing tissue, digesting it. Microscopic examination of infected brain tissue shows something called trogocytosis, a process where the amoeba literally nibbles on living cells, taking bites out of neurons while they're still functioning. The immune system responds, but in the worst possible way. White blood cells flood into the brain, attacking the amoeba, but also causing massive inflammation. The brain swells. Because the skull is a rigid container, swelling brain tissue has nowhere to go. Pressure builds, blood vessels rupture, tissue dies from lack of oxygen. This creates a condition called primary amoebic meningoencephalitis, or PAM, and it progresses with terrifying speed. The initial symptoms appear 1 to 12 days after infection, usually around 5 days. They start mild: headache, fever, nausea, stiff neck. Symptoms that look like bacterial meningitis or a bad flu. Most people don't even realize they have a brain infection at this stage. But within 24 to 48 hours, symptoms escalate dramatically. Confusion, hallucinations, seizures, loss of balance, sensitivity to light. The frontal lobe damage causes personality changes. People become agitated, disoriented. They lose the ability to focus or recognize loved ones. By day 3 or 4, most patients fall into a coma. The brain swelling becomes so severe that it herniates. Brain tissue gets forced through the base of the skull, crushing the brainstem. Respiratory and cardiac centers fail, and the patient dies. So why is Naegleria fowleri so lethal? Part of it is location. Brain infections are inherently difficult to treat. The blood-brain barrier prevents most medications from reaching therapeutic concentrations in the central nervous system. Part of it is speed. The infection progresses so fast that the immune system can't mount an effective response before critical damage occurs. And part of it is that the amoeba itself is resilient. Naegleria fowleri can survive inside white blood cells that are supposed to destroy it. It resists phagocytosis by immune cells, sometimes even killing the white blood cells attempting to engulf it. There is one drug that shows some effectiveness: amphotericin B, an antifungal medication. But it has to be administered directly into the brain via intraspinal injection, and even then, survival is not guaranteed. The few survivors receive treatment within 24 to 48 hours of symptom onset, a window most patients miss because initial symptoms are too generic. Recent survivors also received experimental drugs like miltefosine, an antiparasitic medication, combined with induced hypothermia to reduce brain swelling. But these are desperate measures with limited data. We don't have a proven treatment protocol. But here's the truly strange part. Despite being so deadly once inside the brain, Naegleria fowleri infections are extremely rare. Millions of people swim in warm freshwater every year. Countless exposures occur. Yet only a handful of cases are reported annually, usually 0 to 8 cases per year in the United States. Why? Scientists don't fully know. One hypothesis is that most people's immune systems clear the amoeba from nasal passages before it reaches the olfactory nerves. Another theory suggests genetic factors might make certain individuals more susceptible. There's also evidence that previous exposure might provide some immunity, though this is speculative. What we do know is that certain activities increase risk. Diving, jumping, or submerging your head in warm fresh water forces water deep into nasal passages. Water sports like wakeboarding, water skiing, and tubing create high-pressure water entry. Nasal irrigation with contaminated tap water has caused infections. Using neti pots with improperly treated water. Even religious rituals involving nasal rinsing have led to cases. The scariest part isn't the rarity, it's the unpredictability. There's no way to visually identify water containing Naegleria fowleri. It's microscopic. You can't see it, smell it, or taste it. The amoeba doesn't make water cloudy or discolored. A lake can look pristine and still harbor the organism. And testing water for Naegleria fowleri isn't practical. The amoeba's distribution is patchy. It might be present in one section of a lake but absent 10 meters away. Testing would require constant sampling, which isn't feasible. Some states have posted warning signs at lakes with confirmed Naegleria fowleri presence, but this creates a false sense of security. Absence of a sign doesn't mean absence of the amoeba. Public health messaging focuses on behavior modification. Avoid submerging your head in warm fresh water, especially stagnant ponds and hot springs. Use nose clips when engaging in water sports. Never use tap water for nasal irrigation unless it's been boiled, distilled, or filtered to remove microorganisms. Climate change is extending warm water seasons, potentially expanding the geographic range where the amoeba thrives. Cases have been reported in northern latitudes where they were previously rare, possibly because summer water temperatures now regularly exceed thresholds for amoeba growth. There's also concern about premise plumbing systems. Naegleria fowleri has been detected in water heaters, shower heads, and building water systems that maintain temperatures favorable for growth. Most cases are still linked to natural bodies of water, but the potential for premise plumbing infections exists. Right now, Naegleria fowleri remains one of nature's most efficient accidental killers. A microscopic predator that evolved to hunt bacteria, but can, under rare circumstances, destroy a human brain in less than a week. And the most unsettling part is this. The next time you jump into a warm lake, you'll probably be fine. Millions of people do it without incident. But somewhere, in some body of warm water, someone will be the unlucky exception. Right now, I'm trying to explore the most extreme organisms at the smallest scales. Creatures that operate by rules we barely understand. but it takes time and resources to research these organisms and present them accurately. So if you enjoy these deep dives into the microscopic world, your support means everything. Thank you, truly.